Hello, welcome, and thank you for joining us this evening for this sixth webinar in the Living and Learning Empathy in COVID-19 series. It's difficult to fathom the journey we've all been on since the middle of March, how life and community as we know it have been dismantled. In a strange way, perhaps, being forced apart has made us be more aware of those around us, has forced us to think, to be conscious of being aware. So in ways, I think we have all started our empathy journey without realising it. This evening's webinar is going to focus on the impact of the pandemic in the area of public and patient involvement, PPI as we know it, in research. My name is Edel Murphy. I work in NUI Galway on the PPI Ignite programme. In Ireland in recent years, there has been a big increase in PPI in research, driven to a large extent by the Health Research Board, our main funder, the HRB, who fund the PPI Ignite programme, who have been big drivers of this area. The essence of PPI is about hearing the patient experience, hearing the public perspective, bringing the public and patient to the decision-making planning table. At the essence, at the core of PPI, empathy and respect, listening to different perspectives are driving it. We're going to consider whether there's an opportunity for empathy to flourish, for respect to flourish during the pandemic. Research has never been to the fore and in the public eye as much as it has been in recent weeks. Very much looking at a rush maybe to find a vaccine, to find new treatment approaches, to explore the impact of the pandemic on society. But the very term that we've heard, COVID rapid response research, by definition, there isn't going to be time to spend in the same way on every phase of the research process as we normally would. Something has to give, schedules have to be tightened. PPI is likely to come under pressure. If there is less PPI, do we make poorer choices about what research will be done? Do we make poorer decisions on how we do the research? Are there things we can learn about PPI in these circumstances that will help us now and in the future? This evening, we have a really broad range of speakers who are going to talk about these topics and how the pandemic is affecting us. We have the researcher perspective, the public perspective, the patient perspective, research charities, and the research funder. And with an international dimension, we have a view from the UK and from Australia. I'll introduce the speakers as we move around. And I would just say to those of you who have joined us, please use the chat function to give us questions that you'd like the panel to discuss as we go. So we'll move over now to our first person this evening. So I'd like to welcome Professor Jeannine. Sean has been working as a doctor, a frontline doctor in Galway University, and as an academic, a research academic during the pandemic period. Sean, PPI is very central to your approach to research and patient-centred care to your work as a doctor. Have you had time to reflect from your experience in the pandemic how it has affected these core values?
Good evening, Edel. Thanks for inviting me to participate and for that challenging opening question. So I'm, as you say, I'm a diabetes doctor, and I see patient involvement, if you want to call it that, as a key element of delivering good quality, high quality diabetes care. Diabetes, in my opinion, is all about self-management. So you can have the best diabetes doctors and nurses in the world, but unless the patient is on board, things don't happen. And so for me, the working in public and patient involvement in health research was an easy transition, because I think the philosophy or the thinking is similar. You know, doing good quality research should involve the people who are affected by the research, by the outcomes of the research, and So PPI is something that I see as a key element of doing good quality health and social care research. Has the pandemic affected it? I think in terms of diabetes care, first of all, patients, I think, have had to focus more on self-management and looking after themselves well, doing all of the things that they know are important, but doing them better and keeping well. There is, of course, a role for us healthcare professionals, but a lot of it has been down to patients and their own self-management, including their managing their mental health. As you mentioned in your opening comments, I think that the pressure and the emphasis on a rapid response has made PPI difficult to deliver in research with a COVID-19 focus. And I think that is a missed opportunity. In Ireland, we have developed a national research ethics committee focused on COVID-19. I would like to think that at some point in the future, we might imagine a world where we have a rapid PPI response as well. I think it's doable, but it hasn't been done.
And Sean, thinking about the researchers that have responded to the rapid research call, where do you think PPI was or is in their priorities? And were there particular challenges related to PPI that they encountered in preparing their submissions and in now trying to carry out their research studies?
Yeah, I think that doing public and patient involvement properly, doing it well, does not lend itself to a rapid response. So I think the opportunities for the researchers to develop a good working relationship with a person or a group of people, that's really challenging when the emphasis is on turning things around quickly. But for us as a research community, I think providing an opportunity for the voice of public and patients to be available is something that we can imagine and that we can potentially incorporate. And I'm looking forward to hearing from Anne McKenzie later in the webinar. I think that the approach in Australia, in Anne's area, has been to adapt an existing advisory group to advise on COVID-19 research. I'm not saying it's easy, and there's no question of the researchers having any malintent, but I think for us to consider the opportunities in the future for making, as we did the research ethics approach, for making PPI available, for providing opportunities for the voice of the public and patient. Everybody in our society has been affected by this virus, and so we should have provide an opportunity for public and patients to contribute to the prioritization, perhaps, of research, to how it is framed, how the research is undertaken, how the results are disseminated and made available to members of society.
Okay, Sean, thank you. I'm sure some of the other people this evening will reflect some of the points you have raised there, or particularly around the public and patient perspectives. So this might be a nice time now, or a good time, to move over to our second contributor. So we welcome Casey Donaghy. Casey is a young PPI contributor living with an ongoing health condition, who works with us as a PPI contributor here in Galway. Casey, thanks a million for joining us this evening. As a PPI contributor, you're used to drawing on your lived experience to help researchers shape their research. Tell us, what has the lockdown been like? How have you experienced it over the last number of weeks?
Hi there, thanks for having me. It's hard to say one thing about it, I guess, but it's been quite a strange time when we're all on our own. We're all kind of experiencing different life. It's different to what we're used to. And that's kind of what I've been thinking a lot about, kind of PPI and involvement For me, I haven't got a lot of involvement so far, but people like that I've been talking to have been kind of asking about how to cope in this time, and I've been kind of wondering kind of where the research is, or I just haven't got my eye on kind of PPI and research on kind of developing coping strategies, or how to kind of I guess adapt to these changing circumstances. I know with my personal experience, I've cerebral palsy, which is a physical disability. So I've had to learn how to cope with lack of accessibility to buildings, to things like that, all throughout my life. So this kind of COVID-19 isn't, excuse me, isn't too new, but it's still a strange time, and a time that I'd love to be able to kind of spread that knowledge, have a voice in PPI. It's definitely a different time, but it's a time that people need the chance to speak up and to be involved, I think. Obviously it's a crisis, and we've got to prioritize needs and necessities, but I think there's still space for different needs, different research that isn't solely on, hospitals and, uh, the pandemic crisis. There's other things like crisis management and kind of looking at, different ways of adapting. Um, but in all, I think it's just been a time for adapting.
Yeah, Casey, and as you say, you're used to living without maybe being able to do everything that you want to do, and that's a really valuable experience that you are ready to share with researchers. And I suppose one of the big issues that researchers struggle with is how to reach different target audiences. So as a young PPI contributor, are there ways that you would be able to help researchers, particularly in the current restrictions, to connect in with, if they were targeting young people to take part in the research?
Yeah, for sure. I think at the time there is now, like everything is online. So I think that's going to be the huge focus of connecting with people online, using social media, using forums like Twitter or LinkedIn to connect with people. Or if you're brave enough to put yourself on video on YouTube, or TikTok is the new kind of relatively popular social media. So, using these forums, I think, would be a popular way to connect with people of my age, younger and older.
Excellent. Yeah, thanks a million, Casey. So we'll move along now. We've had on to our next speaker, and this is, I'd like to introduce Dr. Avril Kennan. Avril is the CEO of Health Research Charities Ireland, an umbrella organisation for patient organisations. And Avril, looking in from the outside, it seems to be a really challenging time for charities. What does it look like from the HRCI point of view?
Thanks, Adele. Yeah, it is a very strange time for charities at the moment. So on one hand, you've got people like Casey who maybe would love the opportunity to get involved in some research planning at the moment, but for our charities who are very, very focused on that in general. So they're a very interesting group because they sit at the interface of the research community and the public. And so they have this really important role in facilitating PPI and in bringing it all together, and are very strong promoters of it. But of course, they're going through crises of their own at the moment. So I suppose the most obvious one is the fundraising aspects, where their fundraising has taken a massive hit. And I know from working in a charity, in a patient organization for the last recession, just how devastating an impact that can have on a team, and the struggles that come with that. There are also, of course, many of them are representing groups that are more susceptible to the clinical impact of COVID. So that's a very, very strong focus for them. And my experience over the years has been in those charities that are focused both on research and on patient care. In times of crises, it's the patient care side that will win out. And actually, it's really important to have strong voices saying, don't forget about the research, because actually the research is future care. But it's just human nature that we jump to meet the immediate needs, of course. So that's a big challenge as well. So there are some excellent examples of PPI ongoing, but definitely it's something that is not necessarily a very immediate focus, even in these organizations that see it as being so.
That is really interesting, Avril, because as you say, these organisations are very, very committed to the concept of partnership with researchers. So again, I think, this is an interesting journey to understand everybody's perspective coming to the table. And I think you did a bit of research looking at how the universities are coping with a number of things, one of which was PPI. And I suppose the second part of this question would be, you mentioned PPI is continuing. Are there particular challenges, or what were the kind of achievements, I suppose, where it has continued, and what are the risks or challenges going forward?
Yeah, thanks, Adele. So yeah, we did this survey that we just published last week of 8 Irish universities, and we were asking about the impact of COVID on health research in a broad sense. And right up there with the things you might expect with these big barriers that we're seeing at the moment in terms of people not having access to their research spaces, and also not having access to participants for studies involving people. The research offices in the universities did also report that there are big barriers to PPI at the moment, which I suppose in many ways is no surprise. And coming back to the theme of empathy, I think we probably, in some ways, it's not okay that PPI is not happening at the moment. But we also need to understand why it's not happening. And Sean talked a lot about that. And as he said, there's no bad intent on behalf of the researchers. But it's that the fact that, as Sean said as well, that we were looking to for things to happen rapidly at the moment. But I think it's also because there's a lack of history in PPI. So the researchers don't have those pathways and those skills to hold on to in this time when things become more difficult. So from our perspective, on one hand, we want to shout about it and say, look, this needs to happen. And I think we're getting to that point now where we really need to pressurize it and make sure it is going to happen from now on. But we also felt that unless we can offer solutions to it and help with it, perhaps it wasn't the time to be very negative about the fact that it hasn't been happening so far. And of course, we ourselves are challenged with the issues around the pandemic, and we're not necessarily in a position to really open up things and help with, say, connecting people like Casey with researchers and so on. So sorry, Del, I'm going slightly off track there, but back to your question about examples of things that are happening. So one that is very close to home for us at the moment is we have a joint funding scheme with the Health Research Board, and Anna is on the call as well. And a panel meeting to assess, I think it's 31 research projects is going to happen next week. So those are research projects that have been put forward by our members and will be considered by this panel for funding. And there are PPI contributors sitting on that. So I think that's a really lovely example of keeping it going. I think it's going to be challenging because it's done through Zoom. It's going to be a very long day for the people involved. I suspect we will learn a lot, but it's great that it's continuing.
Yeah, excellent. I think some of the themes there are going to crop up from some of the other speakers as well. So I think at this stage we will take a giant leap, and I extend a particularly welcome to Anne McKenzie, our next contributor, who's coming to us from Western Australia, where I think it's about 1:30 in the morning. So Anne, we're really grateful that you got up to join us tonight. You have a long experience of 20 years or more in community and consumer involvement in Australia, the term you use there. And maybe a good place to start is if you could tell us a little bit about the work you have done pre-COVID in Western Australia.
Hi, look, I'm really pleased to join you this morning, whatever time it is. Look, I think, first of all, I'd just like to welcome, the opportunity to have a say about this. I've been working in a university and a research institute primarily in Western Australia to ensure the voice of the community is, front and centre at the work that's done at these organisations. And then I was fortunate for a few years to head up an organisation that was statewide, and where, again, the whole purpose of what we were doing was to make sure that consumers and community members, or PPI, could be central to the research that was done. So, I've got a long history, having worked in health services as a consumer advocate, and then in this role for the past nearly 17 years. So certainly have built up big networks, both in Western Australia and across the country. And I think it's been a really interesting journey. I've had a lot of support from people in England, and one of your panellists here, Derek Stewart, him and I go back sort of almost to the start of when I took on this job nearly 17 years ago. So, I like to think that, we've established links across Australia and globally. So, I'm really pleased to be here tonight to sort of, tell you about what we're doing pre-COVID and now during this time.
Right, so you were in the lucky position of being able to build on something. So when COVID hit the world and hit Australia, Anne, how did the research community there respond?
Well, I think, for a start, it's really probably important to acknowledge the fact that here in Australia we've got very, very little COVID. Western Australia has also locked its borders very early on, so we have got no active case here, and we've had no community transmission. So I think, we're very fortunate for that. But I have to say, as far as consumer and community involvement goes, at the beginning, in March, when I was hearing of rapid research that was happening, there was no involvement happening. So I was quite, concerned about this. I had some talks with people in the UK and then across Australia. So I spoke to a researcher who wanted at that time, to be able to come back and talk to a group of people about some, important issues that, everyone's been facing, the lack of hospital beds, ICU beds, etc. And so I spoke to my bosses and said, how about if we set up a group that's led out of Telethon Kids Institute, but it would also have some a national basis. So they said, yes, go for it. We've got no money because it's, supported in part by philanthropic donations. So I spoke to 20 people who were either on existing committees at Telethon Kids Institute or people that I'd served with on committees across Australia. And all 19 of them were able to accept an opportunity to come together in an advisory group. And so we established that. It was done in a day, and everybody was really, really keen to have a say. They didn't care about whether they were reimbursed for anything, and particularly that it was all going to be virtual. And so we established a group, and it's interesting to know that whether we'd knocked on the door of researchers, whether they would have involved the community voice or not, but knocked very loudly. And people that know me would know that I've got a big soapbox and a hard knock on the door. And so I'm really pleased to say that, so far this group of 20 people have been absolutely amazing. They've contributed about, over 240 hours of work to consumers. Much of it's been very rapid. For example, in Western Australia, they're doing a school testing program where they'll look at, they'll test 6,000 students and staff across 40 schools across our state, which is a huge state. And this group of people were asked for some feedback on the patient information and consent forms and just general things about how people would react if their child was the only child in the school that tested positive for, being asymptomatic but tested positive for COVID. So, that's the sort of input. We got the information on Thursday afternoon about 3 o'clock and the deadline was 12 o'clock the next day. And it was phenomenal. 11 people, commented overnight and provided really, really good information that was helpful and made sure that it was practical and going to work, and also, the support that was needed for people was taken into account. So this group, we've held 8 virtual meetings, and some of them have been up, had 30 people at the meeting. So that's been an interesting challenge. Hasn't always worked as well as what I'd like. One particular meeting, we had people that were perhaps a bit grumpy or a bit aggressive and not putting their feedback forward in a way that was probably as productive as that could have been. But that was only one person in one meeting. So other than that, I think it's been a very positive experience, and something that, as I said, I'm not sure if I'd not mobilised people from around the country what would have happened, but for the projects that we've had input into, it's been very successful.
Okay, that's really interesting, Anne. I think I'm hearing 2 kind of themes coming through from us so far. Definitely, you built on previous investment in PPI, and then using modification of your methods of, creating teams and so on, and maybe different ways of providing the input. You adapt it to the quick turnaround time. So I think that's really, really interesting, and that, those who were available to contributed. So this might be a good time to move over to Derek Stewart, because Derek is going to talk to us. Derek is a patient advocate that many of you will know. He's been in this space for a long time. And I know, Derek, you have reflected a lot about what the response in the UK has been. I wonder, could you maybe summarise what has been happening there, Derek, in response to the pandemic?
Sorry, I have throat cancer many years ago, so I've blogged what I'm about to say so people can read it if they're interested. I think it's fair to say that patients have not been heard in COVID research. The reactions go from frustration to anger, and they're not about the involvement. They're about the lost opportunities to improve the quality of the research, studies that could have been better explained, less burdensome, etc. But I think it's worth reflecting on the context like that Sean and Avril have set out. This is a life-threatening event. It's frightening. We return to basic instincts. So researchers got on with what they saw was their core job. Patients, we're calm. So we just waited to be invited to the table. We sat and waited to be asked our opinion. Funders reacted by saying, we've got to be seen to do something. So there are some other factors at play. A lot of early COVID research was science and lab based. That's not where the field we play in. We tend to play in clinical research. Secondly, much of PPI in the UK is disease-led. So we have cancer community says arthritis, Parkinson's. This affected us all. And of course, that means you had people who've got the time and the effort. This has been affecting the elderly, BAME communities, and the poor. Those people are not represented in patient involvement. Health inequalities are laid bare. Practically in the UK, a lot of local groups have just turned their focus to COVID and are saying, we'll look at research and help researchers. The Health Research Authority held an online meeting and now has set up a matching service. Researchers can phone them up and email and say, we want to talk to a patient group. Could you just point us in the direction? The health data research, the people looking at all the data science, they've got a really good group of patients, a small working group and a wider network. They've just again turned their attention more to COVID and said, give us a shout if you need help. The National Institute for Health Research, Casey might be interested in this, they're very much looking at mental health and people's well-being and calling for that to be taken into account. Why we do research, the Twitter campaign that Anne's involved in, they've been doing weekly chats. Those are the practical aspects. Strategically, the Academy of Medical Sciences have working with what I would call the acronyms of research, the Association of British Pharmaceutical Industries, Association of Medical Research. You don't need to know them all. They're about to publish a report, so when it's published, I'll put it through PPI Galway and people can see it. I think the UK lags behind Ireland because I think your focus on patient advocacy and empowering the patient voice has enabled EPOSI to just give an unambiguous statement of what's required. Health Research Charities Ireland, as Ivro said, have already looked at where is patient involvement, what are the risks? And the risks are that those staff that work in this area could possibly lose their jobs. So final point from me. I used to think this was about trust, but the philosopher Dame Honora O'Neill says that this is about trustworthiness. Involvement provides us with the opportunity that illustrates trust in our behaviour and demonstrates it in our activities. This is so important. And for me, this is about the paradigm shift. Who owns research? And I think if we address that, we'll be ready for the next rapid needs for everybody to respond. So a quick jaunt through everything. Thanks very much.
Excellent, Eric. You've really given us a good idea there of how the patient body feel their voice hasn't been heard, and then some of the more institutional and organisational responses, which are beginning to come now. So it has been a bit of a journey. And I suppose picking up on that last point you made about who owns the research might be a nice introduction to our next presenter. So our next contributor here tonight is Deirdre McLaughlin. Deirdre is a member of the public who works with us as a PPI contributor. So Deirdre, you very much bring the public voice to research. So maybe you'd like to talk about where you feel the public voice matters in the current environment.
Good evening, and thanks very much, Del, for inviting me. I'd start by saying knowledge and experience comes from many places. And the voice of the public brings a touch of reality to the table because it represents, as you mentioned earlier, the lived experience. And the PPI voice, especially the public part, does not have to be condition specific in order to contribute. It has to be open and it has to be unbiased. And because the public voice is open and unbiased, those uncomfortable, challenging, and key questions often come to light through this public engagement. And engaging the public, it adds a different perspective, a different insight to the research, and it better ensures that the research looks outward as well as inward to increase its relevance and its impact. Now, as many of you have said, COVID-19, it affects all of society. And many of the issues are psychological, they are emotional, and they're totally invisible to the naked eye. So now, more than ever, PPI and the engagement of the public is vital. And it's important to engage with them, to listen to them, to make sure that the research delivers fully for the patient, the healthcare system, and for all of society. So when planning research, I would say that PPI has to be at the table because it matters. And it matters specifically now because this COVID wind has thrown so many challenges at us. They are so varied. And lastly, I'd say that, PPI is very much about inclusion and not just involvement. I don't like that word, actually. I prefer engagement, real engagement that's driven and that's motivated by effective empathy. So, is there a place for the public voice? Is it relevant in this pandemic? Absolutely. And the unfortunate thing is that it is such an untapped resource. It is dreadful.
Okay, Deirdre, and I think it's interesting, where you're talking about so much, the impact of COVID has been so across society, so really impacting the public gives great opportunity for involvement. Have you seen any positive examples of PPI during COVID?
Oh, definitely. But I suppose there's also, maybe definitely not, but let me talk about the good points. iHealthFacts is a website that is funded by the HRB with a myriad of partners, well-known partners. And it is where it's for the public, and where they can check health claims that are circulated in social media. Now, 3 of the public advisory panel that I'm a member of were asked to be evidence advisors. And what one of our jobs is, and the most important one, be to make sure that the published, documented on the website, the answers to the questions is apt and fit for human consumption. So understandable, and it closes off the issue rather than raises more questions. Now, in this particular case, the iHealthFacts team was very lucky that the PPI contributors were already there, we were already in place, and we were already known to them because we had worked with the HRB and some of the other partner organisations previously. So all good. It's a super service. It's starting with the COVID-19 focus, but is there to grow as different issues arise that the public want facts and they want them now. The other really positive thing is that I'm here this evening, and that the public voice has been invited to this superb and relevant conversation. So that for me is a huge positive. I suppose I'll touch on the no, but there's hope. There's hope for it. Sean mentioned the Rapid Response Research Awards. So in Ireland, the first tranche of those got 5 million collectively given across 26 projects. And it just was a golden opportunity to do the right thing and engage the public. Now, the public advisory panel, we've thought very strongly about this, and two of us got together and wrote a letter to the editor of the national newspapers to express our concern. So we decided to bring it one step further, and we went to the minister, and that holds the purse strings for these awards, because there will be another tranche of rewards, or awards. And we expressed our hope and our recommendation, and maybe I should say our strong hope and our even stronger recommendation, that for the next tranche of awards, that they would assign significant weight to evidence that PPI engagement had happened in the research planning, and that there was a commitment to continue that PPI engagement during the execution of the research. So not all lost yet. With around two of the awards, I'm hoping that, irrespective of the word rapid, the patient and public voice adds hugely to it.
Very interesting, Deirdre, but nice to see some good examples happening. And as you say, I think it is an evolving situation that we're all kind of trying to come to terms with. So this is actually an excellent time to go over now to our last contributor at this stage, Dr. Anna Cody. And Anna, I'm really delighted you're here this evening from the Health Research Board. As I mentioned at the start, the HRB have been a key driver in PPI, and you personally over the years. And I suppose maybe before we talk about PPI at all, I'm interested to see how the HRB has been through the pandemic. To me, they're everywhere. So the HRB, like, we're in touch on the day-to-day bread and butter issues of annual reports as researchers. Then you're involved in the rapid research response calls. Then you're in the newspaper supporting, some piece of research that is just done. It just seems to be a treadmill. How has it been at the HRB?
Hi, Adele, and thanks for having me. It's been intense. It's been very intense. So when we started working from home, I think on the 12th of March, and until the end of May, probably, it was absolutely just chock-a-block. So we did have that immense push to think that as a funder, as a research funder, you should be able to do something useful that will help the country navigate through this crisis. And that was a great feeling, because there's something we can do, that's something we can contribute. And I've really found that absolutely anybody I engaged with throughout, whatever it was, everybody was willing to pitch in and to do extra work at all kinds of hours, with extremely short turnaround times. So we did have our rapid response call, which for the first time in my career happened from idea to the start of projects within 2.5 months. That is unprecedented. Normally it is a much longer process. And I have to say that the focus was very much on getting something out and getting, sort of being able to respond quickly. But we've also been involved in, of course, setting up that COVID ethics committee that has been mentioned already. We are funding two very large clinical trials where Ireland is participating in global trials that are of a scale that will allow to actually give the answer to the question, not kind of small local trials that we're not particularly interested in for this particular instance. We have been, of course, dealing with grant holders that have all sorts of queries about, what's going to happen to their award. They find themselves in all sorts of circumstances. Some can work from home and can do sort of productive work for a number of weeks, write papers, reports, whatever, analyze data. And some of them can continue that for a period of time. but there are, of course, others that are impacted a lot more. So clinical researchers, or any research that either involves people or that involves access to laboratories or sort of physical equipment that would be required. So we have to think through how are we going to support the ongoing research, and how do we deal with people, but trying to be in as sympathetic as possible, whilst also not having a cent of additional funding. So it's a little bit of a trap we find ourselves in there. Also, what we find very important was for our new awards that we stipulate that they have to publish their protocols up front, and that they have to publish an open access, and that they have to publish their data, their outputs, as quickly as possible and open access, so that there is no delay in getting the information out there and into the scientific community. So, there have been so many strands to this, whilst we're also trying to maintain as much of business as usual as we can. Because, of course, we had lots of other calls going on that we try to rescue, and in particular where researchers that are, particularly postdocs that are on short-term contracts, they can find themselves now in a position where it's hard to find new jobs. If they come out of a contract, they can find it quite difficult. We also want to keep offering opportunities for funding, and sort of those who have applied to us for other schemes, non-COVID related, we want to keep that going as far as we can.
So really it has been a juggling act right throughout this, as I suppose it has been for everybody individually and organisationally. And I think it is good to hear the HRB kind of perspective. This is about hearing each other's perspectives, and there's certainly a learning in it. I suppose my other question would be, given how strong you are in supporting and promoting PPI, how did you reconcile, or how did the HRB reconcile their strong commitment to PPI with the rapid research funding cause? And given that there's a second one, is it likely to be, are you likely to take a similar approach?
I think what we manage in terms of PPI expectations from us to the research community is quite different between those calls that were out already and the rapid response call. Maybe just to clarify, the HRB is not currently planning to have a second rapid response call, but the SFI, Enterprise Ireland, IDA call, there's still awards being made under that mechanism. So, and we are in contact actually with the other funders. We have unprecedented collaboration between funders, and we also have unprecedented regular contact now between all the main funders and the Irish Universities Association and the umbrella organisation for the Institutes of Technology. So we meet very regularly to check in on each other. With regards to the rapid response call, I have to say PPI did take a backseat, and I'm not entirely happy about that, but it did. And part of that was this tension of, everything I know about PPI so far is that it requires time. And it requires relationships, and it requires, you need to accommodate people, and you need to give people time. This had very, very, very little time. So it was that tension basically that that meant that, for example, we always in our application forms have a normal question and quite detailed questions about PPI, about the PPI that was conducted in the lead up to writing the application, and then the PPI that is planned for the execution throughout the delivery of the project if it is successful. And that was very much subsumed into another question, and there are some applications out of that rapid response call that do include PPI, but certainly fewer than we would have had in other calls, and to a different level. And that is, I think what can be said about those that do is that most of them would draw back on existing relationships they would have had with PPI contributors from previous research, or relationships that they might have developed elsewhere before. And I suppose developing a new relationship with new contributors in an application period of 2 weeks is extremely difficult. And that's something that we'll have to consider. We are currently talking to our co-funders in the HSE, where we're doing normally a call about patient safety and quality, and that's where we're trying to keep the PPI element stronger than in this first rapid response call. That there is some learning from that, to say maybe there were parts of it that were a little bit too fast. And, you're trying to negotiate different pressures and different imperatives there. But, we try to rescue that and keep it as strong as it has been before. I think for our ongoing calls, we have been pretty good. So we have actually just now, 2 weeks ago, for the first time ever, we have used public reviews for applications, not just as feedback to the applicants, but we've actually brought them into the panel meeting. So we gave them back to the applicants for their right to respond. The applicants normally have a right to respond to both the scientific reviewers and now, in this case, also to the public reviewers, just to make sure if there are any misconceptions or anything they would like to address, or any additional information they would like to provide. So this was the first time ever, and perfectly in line with our plans, that we would bring this into the panel meeting and into the decision making. And we've done that now for 2 calls within the last, actually, 2 weeks. And then Avril already mentioned the joint funding scheme between the health research charities and the HRB, where we will have PPI panel members attending that. It is not ideal that you can't meet people beforehand and that you can't have a face-to-face meeting, but we will make do, and I'm sure that the panel meeting is going to work fine. And it is important to us to integrate those perspectives into our decision making.
Okay, Anne, you've touched on so many things there. I think the thing that's coming through from so many people this evening is the strength of being able to build on existing relationships. So probably the message to the researchers who are tuning in and the PPI contributors and member of the public, that it is about, in ordinary circumstances, being able to build your normal relationships, and then when an emergency happens, that there's a fast track, I suppose, in the same way as there's a fast track for everything. Looking at some of the comments that are coming in, some of them very much reflect the points that Anna in particular and Avril have made about the pressures of living in the COVID situation. We've a few students saying, how am I going to finish my PhD? I have children I'm trying to mind, and the pressures of that. So I think coming from very different places, people are experiencing that pressure, but in different ways. I suppose maybe I might go back to Anne Mackenzie in Australia, Anne, because I'm guessing that perhaps some of your previous PPI work may have been online, given the extent or the size of Western Australia, but certainly you're gone online now. What's different about online, and have you any tips for people who are beginning to go online?
Look, I hadn't ever used a Zoom meeting before. I'd taken part in a few teleconferences, but this was a whole new learning experience for me. And I'm very fortunate that all of the people that joined this group, and as I said, there are 19 of them, aged from 19 to 70 plus, with a range of conditions and, you know, health interest, disability, people, Aboriginal people. So, you know, it's very diverse, and to bring them together has been a challenge and probably not the best way of managing it. But I think what we've tapped into is people's altruism and wanting to help. And you know, we've been in lockdown, and I've worked from home for the past 12 weeks now. But so it's been difficult, but I really think that people want to be involved, and it's about, you know, using those existing relationships to make sure that you can respond in a rapid way, exactly the same as what researchers have done. So I don't really have any tips other than, you know, we've learnt as we've gone along, and, you know, here am I at 2 a.m. talking to you at the other side of the world. So again, a new experience for me, and it's just a matter of, you know, having a go and making the best of it, really.
Okay, so very much about adapting, and I think the willingness of people to engage is very evident as well. Maybe we might have one last quick question for Avril. Avril, we're very taken by your comment about the situation in the charities, between funding and trying to support their members. Is there anything researchers can do to make it easier for charities to work with them under these conditions?
Yeah, that's a difficult one, Adele. One of the things that the charities are doing at the moment, we've supported them to develop a form that they push back to researchers who are looking to them for support. And we were worried that maybe it was an extra administrative burden on the researchers, but what we've learned actually is that for a lot of researchers, they like it because they like to understand what they should be doing. So the form asks things like, what are your intentions around PPI? How do you hope it's going to help? What are the timeframes? How are you going to support the patients or members of the public who will be involved? And so on. And so I suppose we would just ask for understanding of the research communities, so that they know that for us it's really important to know these things, because there's a huge responsibility that research charities have to the patients that they represent.
Okay, so to provide that information in a succinct way rather than in an 80-page application full of scientific information is probably very effective from your point of view. So I think we're just about coming up towards 7 o'clock this evening. I think it has been a really interesting and varied conversation with many different perspectives being shared by people. I'm very taken by the consistent message about building on existing relationships. Interesting to hear Derek talking about the patients being frustrated and maybe angry at having been, left aside. And I think as well, you can see there's a bit of a timeline going on in that. In maybe Australia, they were quick off the mark. Anne was quick off the mark and obviously very experienced, and went and knocked on doors. You know, in the UK, there's organisations, beginning now in more recent weeks to take similar stances. So I think this does take time, and like here in Ireland, individually and collectively, this webinar has actually been perfect timing for us in terms of trying to get our heads around it. So I think it is about learning for the future, and I hope everybody who has joined us today will take something away from it that will help them to develop better PPI in current conditions, and also to think about what they do going forward. So at this stage, I would like to acknowledge the conveners of this series, in particular the Professor Pat Dolan, who is the director of ILAS, the Institute for Life Course and Society, and of the UNESCO Child and Family Centre. He has been the instigator of these webinars, and they have covered many different topics and really got us to think about empathy. Certainly, even for me preparing for today, I feel I've gone on a real journey in terms of understanding the perspectives of people I work with all the time, but my eyes have certainly been opened. So I hope everybody has had that sense of seeing the world through different eyes, a different lens today. You don't have to agree with them, but it's nice to see it through it. Thank you for those who joined us this evening. Really appreciate it, and your comments coming in. And above all, a really big thank you to the conversationalists who joined with us. I really appreciate the time and effort you put into preparing for this and for being ready to contribute to the conversation. So on behalf of us all, I will say thank you, stay safe, stay working together, and goodbye from Galway.